Hello, everyone. Welcome to our Signals Notebook Connect community series in 2024. My name is Diana Tran. I'm the Senior Product Marketing Specialist here at Revity Signals and will be your moderator for the session. This ongoing Signals Notebook community series will be an opportunity for you to learn about newly added Signals Notebook functionalities and hear how others are using Signals Notebook to improve productivity and data transparency through enhanced collaboration. As always, we want to hear from you. If you were at our last Connect, we had a suggestion regarding flow cytometry, which leads into our current Connect today based on navigating T-cell dynamics, harnessing FACS analysis through Signals Notebook. Just to let you know, all sessions are recorded and available for streaming at revitysignals.com/Signals Notebook Connect. A couple of quick housekeeping reminders before we start. We'll have ample time at the end for questions, so please submit your questions through the question box located at the right-hand side of your screen. Future dates for Signals Notebook Connect for 2024 have been shared along with this registration, so I hope you will join us for future program scheduled for May 22nd, which will focus on formulations. More details to come in the upcoming weeks. Now, let's dive into it. Overall, we will focus on how Signals Notebook organize samples, instrument protocols, and experimental steps, data capture to facilitate our scientific story of T-cell isolation and activation screening compounds via FACS analysis. We will showcase how this is done within Signals Notebook and have a special treat at the end when showcasing the activation data by FACS for T-cell activation data analysis portion. So stay tuned. I'm pleased to introduce our speaker for today's meeting, Zev Wysotsky. Zev obtained his PhD at the University of California, Riverside for neuroscience, where he worked on taste detection from molecular mechanism to behavioral outcomes in fruit flies. Subsequently, Zev joined startup companies with focus to support scientists getting their science done more efficiently. He has worked within pre-sales team to discover, consult, and deliver software solutions to meet customer needs both scientifically and technically. Today, he is a Revity Senior Principal Marketing Manager for biologics. Now, before we dive into Zev's fascinating insights on T cells, let's take a moment to engage with a quick poll. So, to make the most of our sessions today, we would greatly appreciate your participation in our brief poll. What is the biggest pain point when documenting your science? Finding time to enter data, rewriting and doing work, too long to find what you're looking for, or communicating with colleagues? I'm going to put that up for a brief 1 to 2 minutes.
I should have put all of the above too, Diana. I didn't think about that.
Yeah. Let's definitely do that next time.
Yeah.
Okay, well, thank you everyone for your participation. Without further ado, without further ado, please join me in extending a warm welcome to Zev as he takes the stage to share his expertise with us. Welcome,
Yep.
Zev.
Thank you. Yeah, just really quickly, the poll information looks really interesting, and I appreciate everyone participating. I think I always am number one is finding the time to enter data into the notebook is my number one, but it's good to see the differences here, and we will use that as we work on continuing to discover those challenges and problems with you guys. All right, so let's jump in. Thank you, Diana, for the wonderful introduction. So before we dive into our experimental story, I just wanted to take a minute to address what I think of as an elephant in the room. When we think of drugs, or as samples get larger, so from all the way on the left, small molecules, all the way to large cells, the degree of complexity in general increases from building these candidates or drugs, tracking them and understanding the mechanism of action, as well as notating these or communicating about each of these modalities. And furthermore, working with a variety of these modalities, so creating an ADC, for example, requires software that captures the necessary metadata. It just increases the sophistication. So we require these tool sets to support effective communication toward increasing the speed and accuracy of developing the candidate drugs that we're here to deliver. And as a software company at Revvity, we really think about this a lot. We support many modalities and aim to improve our use cases as we evolve over time. And at the end of the day, I think what you guys are all interested in, or what researchers are really interested in, is a tool that can support experimental design and scientific understanding of their modalities in an easy to use tool while maintaining seamless communication between the teams. So I think it's a good starting point just to kind of level set ourselves. Obviously today we'll be talking about T cells some more on the right-hand side, but I wanted to mention that before we jump into our experimental workflow. All right. So first, looking at our experimental workflow, we'll be collecting clinical blood samples, and once those are collected from patients, all of the metadata required is registered, and then we'll ask to request or perform a T cell isolation from that blood sample. The team will then isolate naive T cells from the blood via a standard protocol and test via fax, verify that they're correct. And then finally, the next team downstream will take these naive cells and screen the various compounds or biologics, in our case, antibodies, to challenge these T cells and assess how drug candidates affect T cell activation profiles. And again, this is where we have additional treat to extend your notebook functionality. So I have a placeholder here for comparing drug candidates. However, due to time constraints today, we won't have time to go into this in great detail, but I just wanted to put it here because this is a critical step when we think about candidate screening, or when we're talking about just screening data sets in general, making sure that our screening is going the way we expect it. But this is the general flow, and I'm simplifying things here. This is generally a lot more complicated than this, and we work with various different companies to do so. But I just wanted to give an overview so you knew where we were starting and where we're ending today. So let's meet our made up or virtual example team. So here is the team working in a fake pharma. This pharma doesn't exist, just to be clear. Vitrona Therapeutics. There are 3 teams. So on the left, Max is the blood collection team who will, basically take those clinical samples and do that. She'll then, reach out to Sammy's team on the assay scientist to, run the T cell isolation and test that they're the right population, and then turn it over to Sheena's team to perform the drug candidate screening for activation profiling. And I think the important thing to talk about, which kind of gets back to the poll, is they work together to accomplish from patient blood sample all the way to looking at T cell activation profiles. Each of these groups works together, makes to screen the candidate drugs for testing. And we need to keep this in mind because it is kind of a challenge, to work seamlessly together when using these tools that are either, disconnected or not easily searchable. And there are, 3 or 4 work streams and data sets being produced, and in this case, highly dependent. So without Max's blood collection, Sammy can't do the T cell isolations and so forth. And the ability for your teams, or in this example, for the teams within Vitrona to be effective is a key metric for drug discovery success. So before we jump into everything, I always like to start with the end first so you can see where we're going. So Here we're seeing the primary data set of gating cell populations via FACS. And this is a great way to verify that the experiment and the T cell are the populations that we are interested in screening. However, what we really are after is to look at the activation profile of each population of T cells from these patients. And so on the right here is actually data from Signals, and this is a dose curve looking at different drug candidate profiles on T cell proliferations, which is a proxy for activation or inhibition of the said T cells. And for example, if we're looking at cancer, we might be, interested in some sort of activation here, right? Because we want to create T cells that are going to kill the cancer. But if we were looking at, an immune response or suppression, we want to decrease the activation of T cells because we don't want an immune response. And the last bit could just be maybe, so whether these are controls or maybe we're looking for drugs that do neither from a safety or efficacy standpoint, so no change in activation. But this assay can basically, help us in the drug discovery process, especially for, the various different disease areas that we're going after. So this is where we're going to end. And I just wanted to show you this so you can see where we're going from our full story. So let's jump into our first step of collecting blood samples and requesting T cell isolations in the Signals notebook. All right, so I'm gonna play this and then I'll walk us through here. So here is Max, and she collects the blood samples from the hospital and will eventually register them within her notebook entry. And we're looking at this dashboard in which she can quickly find an experiment in other areas of the notebook that she's interested, searching samples. We have recent experiments that are on the top left, and any favorited experiments that basically allow her to get into what she's looking for quickly. However, I wanted to showcase the ease of searching for experiments and create by searching for a few words of interest. And I can also filter by experiment to find the actual experiment for Max. So Max is accepting clinical blood samples. Here's the experiment itself. We can follow the protocol here, handling and registering these samples for the downstream T cell isolation request. And this is likely done via like a barcode. So in this particular example, we're going to add a new sample. I have her in this particular example typing this in, but this would be scanned, which by the way, Signals notebook does support. And so this is just showcasing the necessary metadata, and then we will add this to our database. So I'll have her finish this here and then add it. And then once she adds this, she will be ready to ask Sammy's team to perform the T cell isolation, which is all within her notebook. So we'll go to the tasks now and go ahead and type in the necessary information to push that downstream. So, yep, so we'll see that here. So we can create new tasks. This happens to be, for preparation or a T cell isolation, but you can imagine we can also perform other tasks as needed. And then once this is submitted, we will then get emails or notifications within the product to the following team or to Sammy's team. Perfect. All right, so if we move on to the next, just to summarize very quickly, Signals Notebook allows Max and team to easily plan and execute potentially parallel blood collections, organize data capture, and then while finally being able to communicate and share samples for that downstream testing. Perfect. So now we'll move on to Sammy's team, who will isolate the naive T cells. So again, we start in the dashboard view. However, in this particular example, we'll navigate to the tasks that have been requested by Max for the T cell isolations. And Sammy can easily navigate, select tasks in bulk or one by one to control the workload for his experiments. So you can see in this example, we have 3 different patients from the 3 samples, and we'll then create that experiment. Now, this is a templatized experiment, so he doesn't have to think about it. He knows what he's going to be doing, and he just grabs that information and selects the notebook of where that lives within his work stream. So he'll create this new experiment, and all of the tasks and the context, right, because it's a template, will all be captured and ready to go. So again, saving Sammy a bunch of time and headache. Then we can look at all of the biological reagents and equipment. So kits, we can look at the high-level view of the things I need. So he's using a T-cell isolation kit and the various different equipment that he requires for his protocol. Here's the protocol here that he will follow, again, all within the template. And at the end, we'll run a FACS analysis. Now, in this particular example, I've dragged and dropped just a FACS image for the T cells that I'm requiring. So I require a CD3 positive and basically naive T cells that I'll push downstream. And I've just dragged that in so that image is there. And then I have this CD3 T cell metadata, all within my experimental results. And this is sufficient for this particular example. But as we see, when we do downstream testing, we'll talk a little bit more about how this needs to be, we need a much more different analysis for the screening. So just to summarize that piece, the Signals Notebook centralizes all the tasks in one place for Sammy to perform the experimentation. The templatized experiment allows him to standardize work for ease of data capture. And as you guys have heard me, for those of you who are familiar with FACS analysis, the yes/no answer is extremely insufficient for screening drug candidates. We need to see curves, we need to see much more detailed information, and it's more sophisticated. So don't worry, in the next scene, we will show this. All right, so this brings us to our kind of third and final A/B scenes. Why don't we go ahead and start this, and we can walk it through. So now that the T cells have been isolated and verified naive, Sheena will now be able to run the T cell activation protocol. So again, in the notebook, she has the 3 tasks, which are the 3 cell lines, which represent the 3 patients. So cell lines from each patient. And I want to call out in just a moment the equipment and reagents, specifically the antibodies. So we'll have some for staining and we'll have some for actual testing. And you can select and visualize the biological relevant details and metadata at a high level view as we're showing here. So next, what we'll see is the relevant metadata for the T cells, and this is to call out inventory to track containers and movements of cells. So, again, all within one space. Within the notebook, we don't have to go to different places. And now on to day 1 of the 4-day protocol, T cells will be incubated with the drug candidates for an 8-dose concentration to generate these dose curve response profiles. And we'll be seeing the plate level view showing the 3 different plates, which are shown here. And then the various map views, well format will show the doses, which is here, materials showing the drug candidates, or the concentration view, which we provide, which will also be able to provide an Excel-like view. So you can see the well format, the rows, the columns, and the plates. And then next we'll move on to our worksheet, which will allow us to capture real-time changes, so that's here, and timestamps of anything that's associated with the user. So in this example, I need to make a change. I'm adding a new time point, for example, and that is all connected. So I'm going to pause this just for a moment. So before I move on, in the remaining product demonstration, we'll capture the raw output from the FACS instrument, And it's important to call out that whichever instrument you use, whichever flow cytometry instrument or FACS instrument you use, Signals data capture is instrument agnostic. And what I mean by that is that it's okay that you use many instruments or that they're different. We can support the data capture piece. So I want to shout out to this Signals DLX, which is a mechanism of how we can support data ingestion or integration between instrument and the notebook or the database. So in this particular example, Sheena wouldn't need to drag and drop raw files or manually do any of that. The raw data would be pushed into the notebook programmatically via the APIs or that integration. All right, so I'll continue on here. So here you can see the raw file. And it has its various different columns, etc. And another just quick way to mention this is that you could also link it out. So like maybe I have a data link there in which you would have the raw file. Now this is the special part, this is the treat. We are going to extend the notebook piece where we're actually going to launch the data processing part of Signals. And this will be, the data will be ingested and then processed to show different T cell population activation profiles from our drug screen. So here in the data import step, we can scroll through, or excuse me, we can select all of the files. In this particular example, we only need to select one. We can add that item and we'll save that, and that will basically push that information in. So wait for that to finish. And in this case, we have 11 steps. I'm not going to show you all of them, but here's what activation profile looks like quickly. So really quickly, we're looking at do we see any activation? Dark blue is active, white is inhibited, and light blue is no change, right, from the plate. So we want to make sure first we have the correct data sets and plate map views to verify the ingestion is correct and organized as expected. Before the dose response curves, we need to normalize. Oh, excuse me, I'm getting too fast. So we can also look at the plate map views, which is what we're seeing here. And then we need to normalize these data sets. So that's what we'll do that before we get to the final data. And this can look for remove outliers, initial differences, and some, you can actually see some of the donor information as well. Okay, so here we can see the 4-parameter dose curve response. And this, we can look at different cell populations for activation profiles, as I mentioned, and these results should look familiar. I showed these in the beginning. We can see increasing of the T cell activations. We have some inhibition of T cell activation, and then there's no change for control compounds or compounds that had no effect. We are also able to look at various different subpopulations. So in this particular example, this is the total proliferating cells. We want to now look at CD4 positive cells. We may also want to look at percentage of CD25 within the CD8 population. And then lastly here, we've calculated the IC50 and hill slope curves. So we can, hold on a second, I'm gonna pause this, going a little too fast. So we can actually look at, see if we can go back. Oh, I can't, oh, I just messed it up, hold on a second. One moment, Pete. Oh, no, it's not gonna let me, is it? Lovely. Well, what we were looking at there was the IC50 and hill slope curve analysis for each donor and drug candidate. And this is very useful when drugs, looking at drugs safety and efficacy. Let me see if I can finish the last piece here. Apologies. Okay, so I should be able to. No, you are so mad at me. Oh, that's unfortunate. Well, okay. Finally, which I'm not able to show here right now because my video is not giving me what I want. Let me see if I can maybe drag it. No, it's being silly. Anyway, finally, what we will eventually be able to do and to kind of bring us home is, I guess this is a good a view as any. So what we can do from our data processing center is generate a report. So all of the 11 steps that we have in this particular protocol from the data ingestion of the raw file to the secondary data processing, we're looking at all of the, the various different profiles of the T cells activation profiles. That needs to be a report, right? We have, various different cell populations we care about, and the various different images that we're looking at in this particular view. That can automatically or be programmatically pushed back into the notebook. So this view that we're looking at here, even though I wanted to show you that I'm pushing in, you'll have to take my word for it, and we can share out a video later, is that information can be pushed back into the notebook and can be downloaded or shared, shown in a PowerPoint presentation, et cetera, in various different forms. So we can either talk about the assay, how well it's doing, or we can talk about the data itself. Hey, this candidate is showing really great activation for our cancer profile, or this candidate is showing really great inhibition for some immunology target that we're after. Or hey, we don't expect to see any activation or inhibition, and the drug candidate screens that we're doing are not showing those. So that's at least a good check for us from a safety or efficacy standpoint. So that's the sort of special pieces that we've taken you a little bit outside of the notebook, but let's talk about sort of that summary. So Sheena or yourselves could find value in the notebook and beyond here with centralizing the data, standardizing and making data capture easy with no manual entry, as I mentioned, and then extending her notebook functionality with Signals Research Suite data processing. So it walks her through, or anyone on her team, and maybe she's in San Francisco or teammates in New York, it will be a standardized process to walk her team through and capture that data and spit out the report back into the notebook for data analysis and communication. Okay, so this brings us kind of to the beginning, as I discussed, where the team is going to meet together to discuss the activation profiles for various drug screening to advance. And although I don't have time, to go into this in greater detail, the ins and outs of the Signals Research Suite data analysis portion, we have shown the power of Signals Notebook throughout this process and how it connects to a larger ecosystem of the Signals Research Suite. So, we're making these naive T cells from blood, gathering the necessary data context, performing a drug candidate screen via fax, and observing those activation profiles, and consistently and easily stepping through that secondary analysis for the report generation. And then again, pushing that back into the notebook for the final decision. So with this last slide, I'll conclude my part of the presentation and turn it over to Diana to take us through some analysis and then the Q&A section of our Connect. And Diana, you may be muted. Are you on still?
Hello?
There we are. I hear you.
Oh, perfect. Thank you. I apologize for that.
No worries.
Technical difficulties. Well, thank you, Zeb, for that incredible and insightful presentation. On another exciting note, I wanted to let you all know that we'll be participating in the upcoming Bio IT World Conference from April 15th to 17th. We'll be located at booth 519, and we have a special treat in store for our valued customers. On April 16th, we'll be hosting an exclusive customer appreciation event, and we would be thrilled to have you join us. As a token of our gratitude for your continued support, we're offering first priority to those who have joined us today today's Connect. Space is limited, so please don't miss out on the opportunity to connect with us in person. For those of you in the Boston area, I extend a personal invitation to come and meet me at the event. It would be an honor to have the chance to connect with you face to face and discuss your experiences and explore how we can continue to support your scientific endeavors. I'll also link the Bio IT Customer Appreciation event registration in your chat box now. So you should see that coming through momentarily. And then, now that we've reached the moment you've all been waiting for, the Q&A session with our esteemed expert, Zev. To make this interactive experience even more engaging, Zav will now be joining us via webcam. Zav, we're thrilled to have you here with us today.
Yep,
So
good to see
thank
everyone.
you. Now I will look into the questions at hand. Now with the first question, how can we gather and analyze all assay data generated against a single donor?
So how can we gather all assay data associated with a single donor? Yeah, that's a great question. I mean, I think there's a couple levels to that. One is just setting up an experiment to allow you to do so. So within the metadata, we can associate donor with blood sample with T cells that were isolated, and then any of the data that was associated. So you can see the full, what do I call that? The full like data lineage, or being able to track that all the way back to the donor. So that's within sort of the data and results model is our team of experts who help roll out the model or work with your team to do so. We would create a very parsimonious data model to help you kind of understand the end-to-end process that you require and so you can see the data connecting them. So that's one simple answer. The more complicated answer would be depending on whether you just have the Signals notebook or you're looking to upgrade into kind of getting the Signals Research Suite. We have a way of of the analytics to kind of connect what I would consider somewhat disparate data sets in ways that you may not know is possible. But I'll stop there just to not overcomplicate things.
Thank you, Zav.
Yeah.
When entering data, how does Signals Notebook make it easier on scientists?
Yo, gosh. That is a big question. So it does it a couple ways. I think, nobody wakes up and goes, gosh, I can't wait to fill up my notebook, right? Everyone knows it's sort of a little bit of a necessary, I would say evil is the right word, but a necessary, challenge. So I think what I've shown you today is a couple things. One, making it easier to search for what you're looking for quickly, whether it's a notebook template to kind of guide you through to enter data where we need to. So that could be necessary metadata that we just have to capture. And so you're only entering little pieces of information and then, being able to follow protocols. One other one I can think of off the top of my head is calculations. So when we're calculating, the various different T cell concentrations or whatnot, we can do math within the metadata. So you're entering one value and then a bunch of math, or if or statements can be calculated to let you know, hey, we're in good shape, we have enough concentration, or nope, we're not in good shape. So you can see that quickly and easily. And then, of course, as far as connecting disparate data sets and communication mechanisms, being able to like walk through a reasonably complicated fax protocol, feeling confident that you're taking the raw data, it was programmatically pushed in, you're walking it through, making sure that you're looking at outliers correctly and doing that in a consistent manner, and then getting that final report and being able to communicate on that like sort of single source of truth. Those would be the big ones that come to mind as far as how we can support you in that regard to make it easier.
Thank you.
Yeah.
We perform a different flow fax protocol that what you showed. Can Revity Signals still support that?
Yeah, so if I understand the question, it's, we don't have the 11 steps. We have, various other steps that we require. As I mentioned in the talk, no matter the flow instrument you have, we can work with the data that comes off of that. And then, from the analysis or normalization piece, we can generally support the majority of what you would be looking for without, knowing in great detail exactly what you want. But being able to, if it's a 4-step or if you need to extend the steps, we want to look at 6 different populations of cells or subpopulations of cells. Yeah, we will be able to support that.
Perfect. We have many other instruments, not just fax. Can they be integrated so data flows smoothly within Signals Notebook?
Yes, today obviously we were focusing on FACS analysis with T cells to showcase some of the biological capabilities of our product, as well as we had a customer or a person who was asking about can you do flow? Uh, we are always interested in different people who are interested in other instrumentations or other workflows. So the short answer is yes. The long answer is obviously we would want to understand what instrument you have and what process you're working on. But I believe we have lots of examples of different instruments. Mhm.
Thank you. We have Signals Notebook, but no data processing. How do we get access to that functionality?
Yeah. So again, just to like level set, we showed in the beginning things that people who have Signals Notebook and sort of know what that is. You saw a lot of the functionality that you're used to. And then toward the end, we had a little bit of a treat to extend into the data processing. So please reach out to if you have a customer success manager, or reach out internally to your current manager so they can get in touch with the sales team on our side. And we would love to talk a little bit more about how that's done to support you.
Thank you. Can Signals Notebook support other scientific workflows? Example is formulations.
So yes, the short answer is yes, and the longer answer is we really would love it if you guys come to our May 22nd. Obviously, for obvious reasons, we will be focusing on formulations, but just to kind of extend that, today we talked about a kind of an umbrella or a smaller subject of doing T cell isolation for T cell activation. We've done antibody drug conjugates, small molecule therapeutics, depending on the modality and the sort of particular set of assays that are generally used with various different modalities in drug screening or drug development. We cover the majority, if not all of them.
Perfect.
Yeah, great
Is
question.
there mhm. Is there any limit of the software type or configuration settings for performing integration of instruments? Rather, do we need technical capability check before integration?
Got it. Yeah, I mean, I think that's always a safe thing to do. But I can say that, like in general, when we think about scalability of our product, we have that top of mind. So let me give you a couple examples. One example could be, we have a bunch of data and we need to either push it or pull it into, Signals Notebook or the database itself. Obviously, we want to like look at that a little bit, but in examples where we might not, let's say, just the data is just huge, maybe imaging data. By the way, we do have a tool for that, a Signals Image Artist. There are ways that we can improve and enhance the processing of that, for this example, image data within those tool sets. So I'll say short answer is yes, we think about that a lot. And for the majority of cases, we can take on that data set. But I understand science is vast. Sequencing omics data can be very big. So we'd obviously want to make sure it's appropriate. Like, would we ever have that data in our system? The answer needs to be yes. And two, obviously we'd want to do a technical check once the answer of yes, we should have this data in our system. But really great question.
Okay. How would you structure the data lineage from leukopak to child cells like T cells, D cells, B cells, etc.? Would they be batches of the parent leukopak or being registered in a different library like cell lines?
Yeah, great question. So that's definitely a little more like detailed, like how would you actually model this? I'll say I am not always going to be the expert in the room, but we have people who can support that. I'll give you just a quick example, not to send us in the wrong direction. Is generally we want to be as parsimonious as possible. What I mean by parsimonious is we want to start with the least amount of objects that connect to each other. So for example, we have a clinical sample. We might collect some clinical data. For example, the patient name, not the patient name, the patient sex, the age, non connecting information, right? Then we may want to actually support the physical sample of the blood leukopak, right? And then from there, we might want to branch out into the spider web of different cell types. So maybe cell type is the most parsimonious, and then from there we have a drop-down menu of like, what is the cell type? Is it B cell? Is it T cell? Is it a certain type of T cell? So I think the short answer is we want to be simple with the data model. We can always build later. And I think one of the great powers of Signals as well, a Signals notebook and the data model is we don't always, like, sometimes when we go into these, and when I say we, I mean the customer and us, it's not always clear what the right answer, quote unquote, right answer is. Sometimes we think we have the best answer, and then you get using the system and the customer's like, wow, this is really clunky, or the way we input data is making this really challenging for us. We can always modify that as needed, and that will not break the data model. So I think that's something to kind of feel a little bit of like a security, but obviously we do our best from the get-go to give you the best and clearest data model moving forward. So I know that was sort of a non-answer, but I wanted to just be clear that we have ways to make sure it works within the data model you need, and to modify it and enhance it and evolve it, because you might bring on another cell, or you might change the data model completely if a modality or scientific activity changes. And that's something we can't really know when we go into it. So I wanted to just make sure that can be modified and evolved. But really great question.
Thank you. Is the handwritten data processing planned for future inputs, AI, ML?
Sorry, can you ask? I missed the first part of that. Can you say that one
Sorry.
more time, Diana?
Is the handwritten data processing planned for future inputs, AI or ML? Like,
so is handwriting data? So if I understand the question, like OCR, like where I'm actually writing information in my notebook and it's being pulled into the notebook automatically, or because it was scanned or something. If that's the question, because I'm not exactly sure where we're going with that. I believe we can definitely get back to you on that. I'll need to follow up with the product manager from the notebook standpoint on taking written notes and pulling that into the notebook. If that is not the question and you are interested in, let me see if I interpret it a different way, handwriting data and then AI and machine learning. I guess I'm not sure how that would connect in another way. So that's how I would answer it for now. But let me know if I'm missing your point or your kind of why behind the question there.
okay. Well, I'm gonna give it another minute.
Yeah.
Okay. Well, thank you so much, Zeb, for that Q&A session.
Yeah.
And much appreciated for everyone who asked the questions in the panel today. Oh, I think actually
One more?
just one more just popped up. I
Sure.
apologize.
No worries.
Currently, Signals have only parent-child relation, but in one case, we need further branching, which wasn't possible. And even if I input the data in it, it may not fit in the data analysis model. So that was going towards the handwritten data processing plan for the future inputs.
Okay. Okay. Let me just take a look at this so I can not take us in the wrong way. But in my case, we need hedging was impossible. I see. Okay. Well, let's follow up on that. I mean, I think we really want to make sure we address that as accurately as we can. It's possible that there may have been some new functionality where we can address that, and that you may not have known, or it's possible that I may just need to confer with our product manager just to verify your particular use case. So I look forward to following up and making sure we address your question.
Yep, we'll make sure to follow up and address your question moving forward in the upcoming days. So thank you for that. And again, thank you for the Q&A session, Zav.
Yeah, no problem.
Please, yep. Please note we showcased our upcoming Connect dates as well as relevant links for further inquiries. So all links are provided in the chat box earlier today. So please check that out. Thank you again for joining us today in our second installment of our 2024 Signals Notebook Connect Community Series focused on Signals Notebook. We'll have our third session on May 22nd, which will focus on formulations. We hope you can join us. Reminder for all that attended this presentation that you're already registered for the series, so no need to re-register for the upcoming sessions. In between sessions, you can stay up to date on Signals Notebook's new features and functionalities via our What's New section of the website and email communications. Links were previously provided earlier. Thank you again for our speakers up for sharing amazing insights in your presentation and for a great Q&A session. We will address pending questions in the upcoming days as well as share the presentation. So I appreciate everyone's time in joining us today. Thank you. Have a good one.